to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Welcome to Public Health America. I'm your host, Dr. William Latimer. It is my pleasure to have with us in the program today Dr. Sam Bradley Jr., Assistant Professor of Social Work at Boston College. Sam, welcome to the program.
Nice to be here. Thanks for having me.
Great to have you here. So I know you've been doing some cutting-edge work on organizational equity or diversity, equity, and inclusion in the workplace. Tell us a little bit about your work.
Yeah, I'd be happy to tell you a little bit more about our work. So we've been very fortunate to receive funding to support the work of our Equity Innovation Lab. And really what that means is we've been able to take with us some of the best practices in DEI, also known as diversity, equity, and inclusion work. And we partner with organizations, both for-profit and nonprofit. And what we do is we try to help them make sense of their employment data. We try to engage them in a process of storytelling and exploration. We use a lot of design thinking-based activities so that ultimately what we are left with is partnering with organizations and employees to design more equitable workplaces. And then we stick around with them for 3 to 6 months, sometimes even a year, to help them see if there's any benefit from the work that they're doing in the workplace.
That sounds like great work. What's the funding source of the Innovation Lab, and what sort of other agencies outside of the college have you worked with?
That's a good question. So we're funded currently by WorkRise, which is an affiliate of the Urban Institute. And in the past 2 years, we've been able to partner with the United Way of Massachusetts Bay and Merrimack Valley, as well as with Catholic Charities Boston.
That's fantastic. So you go into those agencies and you help them sort of understand their data better so that they can foster organizational equity better. Is that the idea?
That is the idea, at least part of it. So, in our work, what we've been fortunate to be able to do is actually to be able to survey over 1,000 workplaces in America. And that has allowed us to use that data in order to be able to benchmark some of the things, mechanisms that we call organizational justice within the workplace. So we're able to see, how are employees doing related to things like trauma, and how are employees doing related to things like a sense of access to opportunities for advancement and promotion.
Got it. That sounds great. Tell us a little bit more about your work, either with the Innovation Lab or elsewhere, and what are sort of the primary things you're trying to move the needle on these days?
Absolutely. So, I was really lucky to get my start doing some organizing with the Forum for Equality in Louisiana. And this was back in about 2014, 2015. At that time, the discrimination in the workplace was becoming increasingly more important. I lived in New Orleans for about 15 years while I was working on my graduate degrees. And we had gotten to the point where we had achieved marriage equality, so one could be married on a Friday, but then they would show up to work on a Monday, and then they would be fired for simply being who they were in the workplace, for being a member of the LGBTQ community. And so I got really curious and interested in, what organizations might be able to do in order to really start to improve the workplace, to make the workplace safer for both queer and trans people, as well as folks of color in the workplace. And so that led to, doing this research and becoming heavily involved in design thinking. One of the things that I really like about design thinking is the opportunity to pull together a group of people who might be from a bunch of different backgrounds and to give them a chance to really say, let's talk about this problem. Let's tell stories about our experiences. Let's share with one another. And then let's start the process of being able to ultimately design something new that is healthier and more engaging for employees.
Sure. Critically important work. So forgive me, are you saying that you know of specific examples of where someone got married and then they were terminated for that? Isn't that illegal?
So unfortunately, at the time that this happened, so this was just after 2015, we had marriage equality. It was the case that workplace protections did not exist in every state in the United States. In fact, if memory serves, almost half of all states did not have any protections in the workplace. It wasn't until there was a Supreme Court ruling in 2020 that actually created the protections more broadly to include LGBTQ folks in the workplace. Prior to that, federal rulings on workplace protections were more narrowly interpreted around gender rather than sexuality.
Got it. So that's an incredibly important change, isn't it?
It's huge. It's a big deal for both workers and for, I would argue an organization's ability to be able to attract the kind of talent that it wants and needs to work in their workplace.
So is that, and I'm just trying to make sure if I understand it correctly. So you're saying that federal law came into practice in 2020?
Correct.
And does it apply to all states?
Yeah, it's a federal ruling, and so it applies to all states. It really boiled down to a problem of interpreting the already existing law when folks would use, words like sex to define sexuality, and it was not clear that people were actually protected in those situations. And so, as part of the organizing work that we did back in 2015, 2016, we actually got the then governor of Louisiana to commit to creating workplace protections through an executive order that only covered state employees. He actually followed through on that, and he did it. And then just a little bit later, we were sued by Jeff Landry. This is the organization that I was working with the Forum for Equality, to attempt to actually stop the workplace protections in the state of Louisiana. And so, this is one of the things that really got me very interested as an academic in the area that I study now.
Sure. So that's truly cutting edge work that is directly related to policy too.
Absolutely. There's different levels of policy, right? And so within our lab, we tend to focus a lot on organizational policy, i.e. things that folks can do to attract workers or to create safe, workplace protections. But it is one of those things that I encourage everyone to think about as workers, to know what your rights are and to be willing to have that kind of conversation with your employer. Should you find yourself in a position where you say to yourself, I think that what's happening right now isn't quite ethical.
Right. Fair enough. With a couple of minutes left, what do you see as next steps in this very important journey? What's some of the work you're most excited about these days that you'd like to see come to fruition?
That's a really great question. I think for me, next steps for our work is to continue to partner with both for-profit and nonprofit organizations. We're really interested in knowing what works, everything from affinity groups to conflict resolution programs, to mentorship and advancement programs. What's happening and are those things effective? And then I think more broadly, the landscape around diversity, equity, and inclusion work is going to see some challenges, state-based challenges that hope to dismantle that work, and so we just want to keep our eye on what's going on and track any kind of legislation that might come up and ultimately affect this kind of work.
Sam, that sounds like some exciting work. Why don't you give us just a little bit more color on what that would look like?
Yeah, absolutely. For us, it's to continue the work that we've already been doing. So that means that we're looking for partnerships with for-profit and nonprofit organizations. We want to really help folks explore, is that affinity group working, or that affinity group program working? Are we doing what we can in terms of conflict resolution? And then more broadly on the state level, paying attention to what's happening with DEI in terms of legislation. So we're really excited to continue this work, and we really think that it's going to have a big impact on our futures to come.
That's exciting. We're going to take a quick break. When we come back, Dr. Sam Bradley Jr. is going to tell us a little bit about his undergraduate education and the significance of that to his career path and professional path that is enabling him to do this excellent work. We'll be right back. This is Public Health America. I'm your host, Dr. William Latimer.
How do you know when you've made the right decision? It's the feeling you get in your gut, the one that tells you what's right or wrong. It's the one that says, sure, I can have a drink, or the feeling that says, okay, I've been drinking, now what? It's the voice inside you that says, I'm buzzed, better leave the car when it's time to go. Plan ahead, catch a sober ride. Buzz driving is drunk driving.
Most hiring algorithms would scream me out.
Some bosses couldn't see me as a leader.
I've run this place for 20 years, but I still need to prove that I'm more than what you see on paper.
I've been running code as long as I've been able to reach a keyboard.
This is what I do. It's second nature for me, coordinating 100 details at once.
It's the way my mind works. I have a very mechanical brain.
I sold them on my skills.
You gotta be so good they can't ignore you.
My magic is
Analytics and empathy. That's how I'm getting clients. You have to have the confidence in yourself to show up and defy the odds.
I am more than who I am on paper.
I never got a college degree. And today, I'm the CEO of my own company. People want to tell me I'm one in a million, when actually I'm one of millions. Stars are all around us. It's time for them to shine.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. So Sam, we always start this part of the segment with the same question, which is, tell us where you were born and about some of your formative experiences.
Happy to do it, Dr. Latimer. So I am originally from Mobile, Alabama. And one of the things early on, sort of in my childhood, was just this memory of the way in which my family always sort of worked to serve and help other people in their community. And so what I mean by that is that my father is a pastor. He's now retired. And my mom's a psychiatric nurse and community nurse, health worker. And so for a long time, I had the experience of actually watching my my dad on holidays and on weekends go and work in a shelter. And many times I had the experience of watching my mom do care coordination with social workers traveling across the county of Mobile to help support women and children who are in need.
That's excellent. And what? Tell us a little bit about where did you attend undergrad, and what was the decision making like leading up to that? Meaning, was it automatic you were going to go to college? It wasn't sure. We've heard every imaginable story that sort of ended in undergraduate education, but what did yours look like?
That's a great question. So, my undergraduate story actually starts when I was about 10 years old. And the reason for that is because I have very distinct memory at that time of my father, who had been trained in the trades as an electrician, choosing to go to college at that point so that he could study religion and theology. He had always felt a very close connection to religion and theology. He had become a minister in the Missionary Baptist Church just a year after I was born. I have very fond memories of being in the church, singing in the choir, really wonderful Southern, music in churches. And so when he started going to college, and I was about 10 years old, he would actually take me to some of his lectures. Now, I can't claim to be very interested deeply in theology, but what I did love was just the environment of learning. And so I took that with me as I progressed through my middle school and high school experience. It became clear to me that that was something that I really wanted to do, was go to college. And so what I really focused on was building up my skill set. I'm a tuba player. And so with my ability to play the tuba, I was actually able to get a pretty healthy scholarship to go to music school. And I took that as an opportunity to also study psychology, and, different cultures that were different from mine. And that really kept me excited and engaged about the opportunity to learn, and to do something that I was hoping would make my parents proud too.
That's a wonderful story, and fairly unique and very positive. So that's great. So where did you go? So you went to music school. Where did you go? Where did you do your undergrad? What sort of informed? I mean, obviously, it's wonderful that you had a very unique skill that was able to provide you with a scholarship, and then while there, also study psychology. Where did you attend, and what was your initial experience like?
Yeah, so I proudly attended Loyola University, New Orleans, Jesuit Catholic institution in the heart of New Orleans in Uptown. And I fell in love with both the city as well as the institution. That probably explains why later on I would go on to get two more degrees in social work, a master's degree and a doctorate in social work from Tulane University. But prior to that, I think what I really had to learn about navigating college is really there's so much freedom in terms of being able to chase your classes, what kinds of experiences you're going to have, the different kinds of friend groups that you become a part of. And I just knew for me that service was a really important part of who I was. This is way before I'd even decided to become a social worker. I knew that public service was important to me. And so once I joined Loyola, the first thing I went looking for was ways to get involved, opportunities to connect to others. So I became involved in a cultural bridging organization called Bridging the Gap. And I also began volunteering on the evenings and weekends with Loyola's Community Action Program, also known as LUCAP.
Very nice. And so what were some, by the way, forgive me, I love what you said about navigating lots of freedom. I think you may be the actual first guest that defined that. And I think that's so important. I remember when I used to mentor undergrad and grads when I was a full-time academic. And a lot of what I would tell them was something that sounds silly, but like keep your eye on the prize and then define what that meant, because there were so many things that someone could legitimately apply their time to that sometimes things would get very diffuse. And it's not that that freedom isn't great, it's wonderful, but it's still kind of trying to, when navigating academics, understand what are the one or two things that are the most important for that student to move their academic life forward. What did you see, Sam? What were one or two things in your undergrad experience that you found to be sort of critically helpful in defining your use of that freedom?
Absolutely. That's the million dollar question, right? Because once you're given all this freedom, it then becomes about you and your desire to pick a goal, set that goal, and then to sort of intentionally start ignoring other things. And this is one of those things that many classically trained musicians will tell you. It's really hard to get to Carnegie Hall if you're not practicing on a regular basis and for several hours a day, right? And so, as exciting as all the other adventures that present themselves are, sometimes you actually have to say, like, this is the thing that I'm here to do right now. And I understand that it's time limited. It will take me 4 years to do this degree. And then after that, maybe I can explore something else or something new, right? So just really keeping your eye on the prize. And I like to do, one of the things I like to do is I keep a list of all of the things that I feel like I'm missing out on when I'm working on a big project or something really important. And I'll keep a list of, like, okay, I couldn't go to that restaurant, or I couldn't go on that trip or adventure. Let me make sure I build that into, like, how I spend my time, like, having fun, like, at another point in time, right? And then the other part of really, like, enjoying and experiencing college is knowing how to take breaks and pacing yourself so that you're really practicing self-care as you move through that journey. So that means, well, I've practiced 5 times this week, so I'm doing pretty good. So maybe instead of practicing like nonstop, maybe I will go on this little adventure, so just to treat myself on, like, going to get like that scoop of ice cream from that new place or checking out that new movie.
What a great summary. You should open up a side business on mentoring students on how to succeed in college. So that's great. What was your next step? You complete your undergrad. Where, did you work for a while? Did you go right into graduate school? What was your thinking at that time?
So I actually went right into graduate school. I was really lucky to get something called the Albert Schweitzer Fellowship, which was a 200-hour fellowship, wherein we were able to work with an after-school summer program that was really focused on STEM education with youth from, diverse populations, from diverse backgrounds. And so, that experience actually really helped me to get to start the process of moving into social work. I met a lot of different people from a lot of different backgrounds that were different from my own. And that actually gave me a bunch of chances to mentor, to talk a lot about college. Lord knows college wasn't always easy for me. As a queer Black man, I had to learn how to navigate some of those spaces that were not necessarily built for me, right? But in particular, to find communities that were communities in which I felt like I belonged, and felt like I could be supported. So those really were sort of my next steps. And then I found myself at Tulane University School of Social Work. I enjoyed my time there, working on my master's, and that further helped me to discern that I enjoyed working with people, and I really enjoyed, working in organizations, learning how they run, learning what fundraising, process looks like. How do we report on our activities and what we're doing, and how do we make ourselves improve our processes and become more efficient? So that just led me into this path of really being interested in organizations. So later on down the line, when I bumped into some activists at the Forum for Equality, it suddenly started to all make sense that I cared a lot about workers and the workplace and how organizations could do better to promote a more equitable and healthy workplace.
That's a great trajectory and a wonderful story. So you got your MSW at Tulane?
I did.
Okay, and then did you go on from there, or is that your terminal degree?
Actually, after I finished my MSW, I worked for about 3 years as a professional fundraiser on a variety of different projects. And during that time period was actually the time period I started to volunteer the most with the Forum for Equality, really learning a lot about these policy issues that impact the LGBTQ community. And I got bit by the grad school bug again. I was like, I'm kind of interested in learning a little bit more about this and doing research and focusing my scholarship on it. So I was lucky to get into Tulane's DSW program, or Doctor of Social Work program. And there we started working on publishing papers about education and curriculum. And I became increasingly interested in the workplace. So not too long after I graduated from there, I was invited onto the faculty at Boston College School of Social Work, where I continue to do that work here. Very proudly, we've launched the very first program for a School of Social Work in DEI, preparing social workers, a program we call Leaders for Equity and Justice in the Workplace, to really prepare social workers to do DEI-based organizational work as soon as they graduate from college. We also went on to establish a Black Leadership Initiative, which is designed to support the practice of Afrocentric social work in both clinical and macro settings. So we're very excited about the work that we're doing here, and I see it very much as a continuation of my focus on using both design thinking and diversity, equity, and inclusion-based principles in the work that the programs I build going forward.
Very good. So with just about a minute left, Sam, if there were, given your incredibly rich experience, both professionally and in terms of your academic sort of pathway, if there was one piece of advice you were to give to a young person or a person of any age, whether in Philadelphia or the Bronx or other urban and rural settings, about the value of college education, what would that be?
So we know that a college education has many different kinds of impacts on your life as you move forward. However, one thing that they may not tell you is sometimes it can feel like you don't belong here. So my piece of advice that I would give is keep your head up. You absolutely belong wherever you are at. And you don't have to prove your worth to anyone. Instead, focus on, increasing your skills, working as hard as you can, and looking for the communities that are willing to support you.
Fantastic advice. I want to thank Dr. Samuel Bradley Jr. for being our guest today, and I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. This is Public Health America. We'll see you next time. Until then, take care.